Go ahead.
Good afternoon to our NOIAW members and our audience. I'm so glad you all could join us. I'm NOIAW member Giovanna Di Biccari, and today we have Dr. Judy Salerno, president of the New York Academy of Medicine. She's here to answer some questions we have about the coronavirus, which will give us a little bit more comfort and in knowing what to believe and how to handle this situation. We invite our viewers to ask any questions they may have for Dr. Judy Salerno. Dr. Judy Salerno, how are you?
Great, thank you. Here in New York City, we're at the epicenter of this coronavirus outbreak, but we are New York strong and we're all working together and pulling together. And I know we're going to come out of this even stronger. So thank you for inviting me to be with you today.
Of course, and thanks for joining us. I know you're probably super swamped over there, huh?
It's pretty busy. I run a health organization. We're not doing direct service delivery, but we are supporting a lot of agencies that are trying to cope with this, doing really specific things like trying to help city agencies locate older people who might be isolated and in need, looking at tracking where this is going, and also a number of us have volunteered, like myself, as a surge provider as we see that hospitals are reaching capacity, and we're seeing the new healthcare facilities being stood up in places like convention centers. So we're ready, and we're on the front lines, and everybody is contributing in their own way.
Oh, that sounds amazing. Amazing. I love the teamwork you have there. So let me start off with the first question. What's the situation in the US right now? And is the curve of the coronavirus spreading going to rise as dramatically as it did in Italy?
Well, you know, that's up to us. If we can observe the social distancing or physical distancing, as we're calling it now, and be really good about limiting our interactions with other people, we can control this. Now, New York City has, just the city alone has over 21,000 cases as of this morning. And we unfortunately are #1 in the nation, but we see a continual rise in states, particularly areas of high density. California, of course, Washington State with the nursing home outbreak was the first hotspot, Louisiana, New Orleans, and we're seeing a really steep curve. It's going up really rapidly. So the number of cases are increasing. We haven't seen the top of the curve, but what we hope is that we can flatten the curve, as they say, that top of the curve will be lower than it otherwise would. And the thinking behind that is that if we have 1 million people in this country who need hospitalization and ventilator care all at once, we can't handle it. But if it is coming, even though the cases will continue to come, but at a slower rate and over a longer period of time, that's manageable for our healthcare system. So it's not about containing it right now, because the virus is here and it's spread to all 50 states and increasing. It's about managing the outbreak at this point.
So you're saying we haven't met our peak yet, but we're hoping that that peak won't be as high as what happened in Italy, or is happening in Italy.
It's up to each and every one of us to make sure that we're doing what we can so that that peak doesn't reach incredibly difficult heights. As I understand it, I've been in communication with, and I know we had, our organization had a discussion with an Italian doctor last week from Rome, but that people didn't heed these early warnings about staying inside and staying away from others as seriously as they should have. And, so if we continue to be serious and to make sure that all of these we can put everything into effect that we know will help, then we can control this. We can't stop it, but we can mitigate its effects.
Okay. Um, at the beginning, we thought that the most affected people would be the elderly. And, in Italy, you've heard how many people that are affected are the elderly there. But we've thought that in the beginning, it would be mostly the elderly and the immunocompromised. Now, COVID-19 seems to attack people from all ranges of age and physical conditions. So is it correct to fear a quick mutation of the virus? And if so, are we equipped to handle it?
Well, the very lucky thing about this is that scientists who have been tracking the genetic signature of this virus say that it's a very slow mutator. So there are only one or two, maybe three mutations per month. That's incredibly slow compared to, like, for instance, the virus that causes influenza. So that's a good thing. So it means that if we develop a vaccine, which will be sometime before we do, but if we have effective treatments, that there won't be a breakout of a newly mutated form of this virus. So that is a really promising sign that once we find the right ways to treat this, that we can make a dent in the seriousness of its condition. Everyone is at risk. Certainly people over 70 with chronic conditions and those who are immunocompromised have a greater risk, and they have to take extra precautions, and we have to make sure that we don't isolate. I mean, we do isolate them, and we don't participate in any social interactions with those people. There have been terrible stories of whole families affected because they had big family gatherings, and we can stop that. So everybody is at risk. Older people and immunocompromised people and those with chronic illnesses are at greater risk for more serious forms of the illness.
Right. And I get that so many people are still gathering together because, when one feels that they're not sick, why there shouldn't be a problem. I'm not sick, you're not sick, let's get together. I've been feeling great for the last week. Usually the symptoms show up in 2 weeks. Is that correct?
Well, anywhere from 2 to 14 days, they say. I have two people that I know who have tested positive for the virus and are ill, thankfully not seriously ill. And they both started showing symptoms, one at 10 days and one at 12 days after what they think was their initial exposure. But of course, we don't know if we went to the store in that period of time or we pressed a button on an elevator, whether we were coming in contact with the virus in other ways, so that we can guess about our contacts. But you're not, if you've been in close contact, you should self-isolate for at least 14 days.
Okay. And can you tell us the difference between your typical flu and this coronavirus? There's so many people out there that just keep spreading news on social media that, well, there's more people that die from the flu than do from coronavirus. Can you explain?
Well, yeah, I mean, in a typical year, 1 billion people across the globe will get the flu.
Mhm.
Now, we have a vaccine for the flu, and so we know that most of us heed our doctors, and we go and we get the flu vaccine. We also have treatments to lessen the severity and the length of the course of the flu if you get it. The symptoms at the onset are very similar, but the breathing difficulties are usually, unless you develop an associated pneumonia with the flu, the breathing difficulties are much, much more severe with COVID-19. And we know that a larger proportion of people need help with breathing assistance, either through face masks or ventilators. and that the death rate, while flu is much broader across the population, the death rate from flu is 0.1%.
Okay.
And while we're trying to still gather information, we know that the death rate has ranged from 1 to, some say, up to 2.5% in different geographic areas, depending on who the virus has affected. So it is much more lethal than the flu. We need to take it seriously.
So you were saying flu is typically 0.1%
Death rate.
and this coronavirus is a whole 2%, more or less.
It's the range of fatalities goes from 1% to 3%, and it's probably somewhere in the middle, closer to 1.25%, 1.5%. But we don't know. Part of the reason we don't know is because we haven't had broad testing. So there are a lot of people who are staying at home with mild symptoms. And that might mean that, while there's a reported number of positive tests at 30,000 or 50,000 or whatever, that there may be twice as many, and we don't know, many people affected. So the denominator, and lending us to figure out the percentage of people who would actually have a serious and be critically ill and perhaps die from this. We don't know what that denominator is, so we can't really calculate it. This is they call it a novel coronavirus because it is new. We haven't experienced it before. And the other thing that differentiates it from the flu is that we don't have immunity in our populations because our populations have never seen this bug before.
So how many months does it take for us to build an immunity to this coronavirus?
Well, generally, if you're infected, you're building immunity at the time of infection. And in fact, there's some hospitals in New York that are collecting serum, blood samples from people who have been recently infected and have recovered, seeing if they can collect the antibodies and perhaps give them to seriously ill patients. So it's another way of considering treatment so that that people who have now, we hope, are immune because they were infected can maybe share their antibodies with those who are suffering.
Correct. So what is the biggest myth you've read on social media, and what do you feel needs to be debunked out there?
Oh, there are so many of them. I don't know where to begin. What's the myth you've heard? And I can just tick off no, or yes. That's.
So I've heard we could pass COVID-19 to our pets can pass it to us. I've heard we should worry more about the typical influenza than we should COVID-19.
That's a no. This is a more serious illness.
Okay.
And you can still pet your dog and your cat. And it's there's not been a widespread veterinary outbreak. And I think that myth started because it was in the animal markets in China where the virus was thought to originated. But the greater risk is not jumping from animals to humans because that already happened, okay? And in the marketplaces, it's human to human transmission, and that's where we can make the most impact.
Well, another myth I've heard is, I don't know if this is a myth or not, you can debunk this, but the kids are immune to it. If kids are immune to it, what age kids? Are we talking about kids that are not, that don't have any compromises to their health system? Is there a certain age range that this virus says, you know what, you're 2, I'll let you pass? I mean, what
well, as of last night, no child under the age of 9 has died from this. Okay. But there are kids who are infected, and there are kids who are testing positive for the virus without symptoms. Doesn't mean they can't get sick. Some are getting sick. There's a critically ill little girl in New Jersey right now. But what it means is that if you have your adorable little grandchild wants to sit on grandma or grandpa's lap, don't, because if they are infected and are relatively asymptomatic, or they may have a little runny nose or something, that they could be spreading the virus to someone who is much more susceptible for a severe case of COVID-19.
Okay. I've heard a couple more of, sleepovers are fine because they're children, they won't get sick. I've heard
No, no play dates. My little nephew had a play date in his neighborhood. They live in the suburbs, and they stood at the end of their driveways and all talked to each other. So you can do virtual play dates.
Right.
Kids can Zoom too. They're probably much better at it than we as adults are.
Yeah.
So there are lots of ways kids can connect. And I know there are lots of kids out there who are dialing up, or I guess we don't dial up anymore, but logging on and connecting with their teachers and their classmates and learning. Distance learning has a whole new life in this environment.
All right, we'll have another question kind of pertaining to this. We've heard many stories about how long the virus stays on substances, such as grocery carts, and we all have to go to the grocery store at some point. Mail packages, door handles. Some places that I've read online say, oh, these germs will last one day. Some say up to a couple weeks. What's the truth? Is there a truth to all of them, but a different time that they stay on those items?
Yes and yes. We're learning as we go along. Certainly there are certain things like that they have been testing, and it doesn't have a long life on copper, for example, or paper. But, to be safe, I would say 72 hours is a minimum. But there are probably instances where the virus does linger longer, but we just haven't been able to fully substantiate that now. But I think at minimum of 72 hours. But a better strategy is if you bring something in for the outside packaged goods, even if you get home delivered things, take a Lysol wipe and just wipe up the package, and just wash your hands and be safe. But again, when I went out to pick up some things the other day, I went to the grocery store, and as we were walking in, there was someone wiping down each cart. So I knew that my hands were the only ones, the only germs that were on that cart, and it was very reassuring. We all need to go somewhere, into the grocery store or wherever. And, even things like your keys, if you've been outside and jiggling your keys, and you need to open your door and then wipe down your keys as well. Things we don't automatically think about.
Good point. So when you were at the grocery store, did the cashier actually wear gloves, or did she bag your items?
Gloves and a mask, and I brought my own bags to bag my own items. And that's another good strategy, that where you can avoid contact, even if it is gloved contact with other people. You're saving yourself from exposure and saving that person in the store as well. So bring your own bags if you need to go to the grocery store.
Okay. Thank you for all of that. There seems to be some stay-at-home and shelter-in-place orders in many cities and counties and states. And it seems to be the only way to flatten out this curve. So far, a lot of us have been home for 2 weeks, but now 2 weeks has passed by, and some states or counties are saying, okay, you have to stay home for 2 weeks. Now the 2 weeks is up. How long do you think we're going to stay home?
Well, I don't think Easter is the milestone we should be looking for.
Okay.
And I think that, we have to see, and we have to trust that our public health officials and the scientists will guide us. And again, it all depends on what we're seeing with the curve. If we're flattening that curve, it's going to be sooner that we all get released. But if we don't, it's going to be a longer time. So can't say it often enough. It's up to us to do our part.
So we'll get released early for good behavior, huh?
Absolutely. They're letting off minor criminals out of jail too, all over the place.
Right. You get a day pass if you behave. Okay.
Right.
So, we've heard Italy and Japan have been testing some antiviral drugs. What have you heard?
Well, there are about 20 different drugs that are being considered now for clinical trials, but we have to realize that none of these have been demonstrated to be effective,
Mhm.
and that we shouldn't take them unless we're part of a clinical trial, and that we really need to understand that these things, while they may work in a laboratory plate under different conditions, that when we test them in the human body, a lot of different things can happen, and some of them not necessarily good. So just because something is promising doesn't mean it works. We need to let the doctors and the scientists do the work. And they're ramping up these research studies very, very quickly. So there are a lot of different therapeutics that are out there being tested right now. A number I know in New York State.
Oh, wow. Okay. Well, we have a viewer question. Viewer is asking, is there any policy regarding treatment of elders in nursing homes who test positive while hospitalized? Are they being returned to their institutions or not? And do you have any opinion?
Well, I'm a geriatrician and I care for older people, and every life is valuable in my view. And I am praying that we don't get to the point where we have to ration scarce resources like ventilators. That we need to make sure that we have these available needed services in the healthcare settings for whomever of whatever age. There has been a lot of discussion in the medical community of people making sure that when they enter a hospital, they have advanced directives. That's like, your whether or not you'd want to be fed or intubated, or what your preferences are should you be at the end of your life or have a disease or condition of a disease where you cannot receive further treatment. These are hard decisions. Let's hope we don't get there. But as far as I know in New York State, there is absolutely no rationing based on age. But make sure that if you go into a hospital setting, or your loved one, your older loved one is in a hospital setting, you know what their preferences and wishes are for their care.
So you're saying that if they have signed for no end of life help at all, I mean, they're just,
Then that you go in and try to make sure that they get as much care and comfort as possible if they are critically ill. Again, just because you're 75 years old with a corona virus infection doesn't mean that you can't recover. I this morning went over my advanced directives with my children, because I think it's a good thing for all of us to do at any age. And in a situation like this, where we might be exposed and we might not be able to express our wishes, then we should make sure that these are discussed with our loved ones. I've had people laugh because I've had advanced directives since I was in my early 20s, because I've seen what can happen when they are not available and medical decisions have to be made in a moment of crisis.
I imagine there's a lot of emotion going on with family members, a lot of arguments with family members, as well as the patient, you yourself.
Yes.
So,
That's why it's important that the patient's voice be there first and foremost, and not wait for those decisions to be made until the person can't speak for themselves.
but I want to reiterate what you just said. You were saying earlier that typically those that get sick or that get really ill from this coronavirus are over the age of 70 or 75. But you just said now too, though, just because you're 75 years old and you do get the coronavirus doesn't necessarily mean, you're going to pass away. You've had
That's right.
patients that have recovered at that age.
That's right. And we have 50-year-olds and 30-year-olds who are critically ill and dying as well. So, and people who are in otherwise healthy condition. So, where there's a lot we don't know about the course of this disease, but we're learning every single day. And we do know that in other countries that more older people have died. And initially in New York State, my state, we knew that more older people were dying, but it appears that the rate of infection in younger people has ticked up too in the past week.
Where do you see, I understand that it's changing constantly, state, city, the numbers of people that are ill. What are the top 5 locations right now that are ill with the coronavirus?
Well, as of this morning, the greatest number of cases far and away are in New York State. And I think we have, I think there, it's, I'm blocking on the number, the total number in New York State, but it's well north of 30,000, 35,000. Oh, here it is. I have it written down. 37,258 cases in my state. And we're followed by New Jersey, California, Washington State, Florida, and Louisiana. And those right now are the epicenters of the outbreak in our country.
Why Louisiana?
Well, Louisiana, apparently they are speculating that there were a lot of people out on the streets very recently celebrating Mardi Gras, and thousands and thousands of people reveling and packed in the streets of New Orleans, and that and people from New York, Washington, California came to New Orleans to celebrate Mardi Gras. So that's what this person-to-person spread is all about. So they think that that was the site of the initial bolus of infections in Louisiana, was from the Mardi Gras celebrations.
Sure, I can imagine. I can imagine. So, what's the situation in New York City and U.S. hospitals right now? New York City and U.S. hospitals. What's the situation there? And is the lack of equipment and workforce still dramatic?
Yes, we're running out of resources in New York State. The federal government sent 4,000 ventilators to the state. We now have over 5,300 patients in New York State hospitalized, and the hospitalization rates are getting higher. Overnight, about 20% of the patients who were seen required hospitalization, which is higher than it's been. And that's because people with mild to moderate diseases are being told to stay at home, shelter in place, and isolate themselves. And only the sickest patients are coming to the hospital. So we're seeing a large number of people who are requiring hospitalization. And they are opening up new health facilities, one 1,000-bed facility at the Javits Convention Center here in New York City, a nursing home that was being built in one of the boroughs with 600 beds that hadn't opened is being converted to a hospital. A hospital that's been closed is being reopened. The USS Comfort, U.S. Navy medical ship, which can take care of 1,000 people is coming on its way, steaming toward New York Harbor. So we're ramping up very, very quickly. The call went out for healthcare providers who are retired or not in active clinical practice to come out. And as of yesterday, 40,000 healthcare providers across New York State have answered that call.
Wow.
6,600 people in New York, mental health providers, have made themselves available to provide support and comfort for people who are experiencing stress and anxiety because of this outbreak. So people are rallying. They're doing extraordinary things. And as I said during an interview last night that I did for the Today Show, that this is, that there isn't a hero. No one is being a hero. We're all heroes if we're doing whatever we can do to the best of our ability to contain this.
I mean, this is fascinating teamwork. Imagine, imagine the mental health professionals, they're probably doing FaceTime or Zoom
Yes.
conferencing or something like that.
Yes.
For their patients.
For free. They're offering their services for free.
This is great. And then the convention center, I mean, a convention center, does that mean all the HIPAA rules go out the window because we're in a state of emergency?
Not the HIPAA rules, but certainly some of the conditions that meet safety codes for hospitals that we can't, retrofit in a few days, a convention center to have everything we need. But they're doing the best they can. The National Guard is helping, and this is where we need everybody contributing what they can.
I don't think I've seen enough of that on television. I feel like I've seen more pictures and videos of the empty streets and how beautiful New York is with just actually being able to see the roads and the buildings. But I haven't seen pictures of, the National Guard. I haven't seen, I guess I haven't seen enough of what you're talking about. And I just find this lovely and fascinating, magical, and can't think of enough words for it.
Yeah, I think it's heartwarming. It really is to see people pulling together in this situation. And, when I looked out the window this morning, the only people I saw walking down the street, and I can only see one block from my window high up on the 27th floor here, but the only people I saw had medical scrubs on. So they were people going to and from their shifts at the hospital. And that just put a really smile on my face. And these people are, they're doing their jobs, but they're at risk. And they're doing it because they care about us, they care about each other, and they care about our community. What more can you ask?
That's amazing. I imagine they're also swamped with hours of work, and then emotional toll. There's an emotional toll on them too, because they're seeing their patients sick, and then they know they might be carrying that coronavirus home. So
yeah, now a wonderful thing happened overnight. The Four Seasons Hotel, which is a fancy hotel about 6 blocks from my house, opened up they had closed down, and they opened up the hotel for providers who don't want to go home and carry the possible coronavirus to their families. So they're camping out at the Four Seasons, which is it's amazing. I mean, just such great effort, big heart, and it makes me so proud to be a New Yorker and an American.
Right. What a way to pull together. Now, I do have another viewer question here. He says, Damien Dupont, hi from New York City. I've heard sad stories about problems at Elmhurst Hospital in Queens. When things get bad at a hospital, is there a way to regain control of the situation, or do they just have to buckle up and write it out?
Yeah, Elmhurst Hospital is about the hardest hit. They have an incredible amount of patients. They're running past capacity. They're running low on supplies. And, I think once we get the surge facilities open, we'll be able to relieve places like Elmhurst, because I think that there will be other hospitals like this. It's a very sad story, but, people doing remarkable things under these conditions. And I'm hoping that they get what they need there very soon. Every hospital in New York City has been, I think it's the city, not maybe it's across the state, has been told to increase their capacity by 50%. So which means that, we're moving people from who have offices and hospitals into our building at the New York Academy, so that they'll have space for moving hospital beds in. So we're doing extraordinary things under very challenging conditions. And we have to hope that those supplies come quickly, that the national repository for these supplies are opened, and that more gets sent to New York, because I don't want New York City and what's happening and the many diseases that, where the cases that are building up here. And I want us to be a model for what can be done if this hits other cities. So, yeah.
Feel that we're ahead of the curve when it comes to having, I know you said we're short on resources, at least in New York City. Do you feel that the US is ahead of the curve with the number of resources that we've already ordered and workforce compared to other countries?
I wish I could say that. I think we wasted some valuable time at the beginning of this infection, and people not taking it seriously enough. That's why I say, when you see 21,000 cases in New York City today, that other cities should heed this, and people living in other places where they may only have 50 or 100 or 200 or even 500 cases, that they should be warned that unless they get this under control and listen to what the CDC and the public health authorities are telling us about what we each need to do, that they'll be facing similar rates of infection.
In your opinion, are you okay with, I heard just the other day that Chicago is giving out fines. I'm not sure if this is myth or not, but they're giving out fines for people that are leaving their homes. If you don't have a need to leave your home, do you feel that that's what it should come down to?
Well, I hate to see our police be using their valuable time, like trying to stop people. They've done some extraordinary things here in New York. Yeah. Like when I went to Central Park last Sunday to get some air, there were people playing basketball, and that's a close contact if there ever is one. So they've taken the basketball courts down, the nets down, so that people can't play. But we're diverting really the human resources needed for other things by people not paying attention. So yeah, go ahead and find them.
To put it simply.
Yeah.
Speaking of going outside, do you feel that there's an organic way for us to have healthier bodies? For example, New York City, everyone's quarantined themselves in their condos or apartments. Would it be a good idea to still go outside and go for a walk and get that vitamin D from the sun and get the fresh air, or open their windows? What do you suggest?
Well, if you keep that distance over 6 feet, go for a walk, even if it's going around the block. And I understand that today they'll be closing off some streets in New York City to make them pedestrian walkways. But, if you're walking your dog and another dog wants to play with your dog, don't get that close. Just keep that distance. That's all important for keeping the spread away. But, get out there for a few minutes, as long as you know the rules. It's good for your mental health as well as your body to, just get out and move and stretch. My girls and I, my two adult daughters are bunking in with me now in our small apartment. We're each in our own corner working. But we got up early the other morning and we did YouTube yoga together. And I know people who are doing that virtually all at the same time and talking to each other through their cell phones. I mean, it's remarkable that we have these technologies where I'm talking to you in another city and there are people we're talking to all over the United States. I had a call with the BBC in London this morning. And, you know, so we didn't have these tools, you know, maybe a decade or two ago, but now we're all using them and we'll be better off for it.
Definitely think that with all the social media and the technology we have today, we do kind of have one foot out the door or ahead of what they did in the past with flus. You know, that was word of mouth or printed newspaper, what have you. But nowadays we've got news that come to us lightning speed, even live stream.
Yes, I mean, the world is, as we know it, has changed. And I think that this will forever change us, even when we come out the other side of this pandemic. And I think it's up to us whether or not we use this as a learning moment and a moment where we come together and connect with our various communities. I would just urge people that if you know of people who are living alone, who are isolated, elderly people, you know, young people who live alone, reach out to them. There's so many ways we can reach out because being isolated doesn't have to mean being lonely. And we know that loneliness can really lead to ill health, both mental health and physical health. So let's try and stay connected.
You're saying just give them a call, not necessarily. I think a lot of people are too
Oh,
afraid.
not physically.
Right.
No.
I think a lot of people are too afraid to go visit or to bring any, you know, their elderly neighbor a lunch or a dinner because they're afraid they might pass coronavirus.
Yes.
Unknowingly.
Yeah. I mean, if people are, you know, need things, food or medications and can't get out to get them, we have to find ways to get those necessities to them. But, you know, I'm saying just to let them know that people are thinking about them and that there are people there to whom they're connected and who care about them. It means so much to all of us.
Right. Do you have any advice, anything else you'd like to share with us? Anything that you've seen or learned as of this morning?
Well, I think, you know, it's going to get worse before it gets better, unfortunately. But, you know, but I think that we are doing so many things well, and we need to keep doing them and ramp up those efforts. And again, the idea that you can, that self-care is as important as caring for people who are sick. So I ask people, whether they're, you know, their neighbors or mental health providers or medical providers or just family members, to take care of yourselves as well. We're all in this together and we'll all come through it only when we work together.
Okay, very good. Well, thank you so much for your time. I know you're swamped. I know you're so busy and you have a hectic schedule. So we really appreciate you, and I'm sure the viewers do too, for you taking your time out to answer their questions.
Thank you. Stay well.
All right. Stay safe and enjoy the rest of your day.
Yes.
In your corner.
Bye-bye.
All righty. Bye-bye.
Thank you.